So let us start with approach to bleeding disorder in children. So let us make a handmade approach. If there is a child who comes to you with bleeding, there is broadly two possibilities, two types of scenarios examiner will mention. The first type of possibility will be the child is coming to you with features like non-palpable petechiae and purpurae. So there will be pinpoint bleeds like petechiae and purpurae, but they are non-palpable. Remember that palpable petechiae goes in favor of Henoch-Schwann and purpura, which is a vasculitis. That is not being discussed here. Then the examiner will say there is mucosal bleeds. So mucosal bleeding will be there. There will be prolongation of bleeding time. But the coagulation test like prothrombin time and activated partial thromboplastin time will be normal. If you have a presentation like this, the patient is likely to have a platelet cause of bleeding. So the cause of bleeding is platelet cause. On the other hand, in case examiner says that there is a child with deep ecchymosis. Ecchymosis are large confluent areas. The patient is having systemic bleeds. Systemic bleeds means there are deep-seated bleeds which are happening, particularly heme arthrosis, bleeding inside the joint. Heme arthrosis is bleeding inside the joint, and muscle hematomas. They may have epistaxis in a few patients. Sometimes epistaxis will be present sometimes. Bleeding time in these patients will be variable. Variable means it may be increased, it may be normal, it may be abnormal, and PT and APTT are affected. In such patients, you will think that the child is suffering from coagulation cause of bleeding. So we have two types of causes of bleeding. We have the platelet cause and we have the coagulation cause. Let us first take the platelet cause. If it is a platelet cause of bleeding, there are two possibilities which should be considered. In case the examiner says that platelet cause is there, then if the number of platelet count is low, you look at what is the associated abnormality. Number low means thrombocytopenia. So this is nothing but thrombocytopenia. If the size of the platelet is normal, you should suspect a ITP-like condition. ITP stands for Immune Thrombocytopenic Purpura. But if they say the size of the platelet is small, size of the platelet is abnormally small, and they write it is associated with rash and recurrent infections, such patients you will suspect a disorder called as Wiskott-Aldrich syndrome. And this will generally be seen in males because it is an X-linked recessive condition. So these are the possibilities you will consider if it is a low platelet count. On the other hand, in case this type of presentation is there, but the platelet number is normal, you will suspect the child is suffering from platelet functional defects. There are two types of platelet functional defects. You have Bernard-Soulier syndrome and you have Glanzmann's thrombasthenia. These are the conditions that should be suspected.